Okay, in today's class we will be talking about rheumatoid arthritis. Now, can anybody tell me from your required readings anything about it? Yes?
Rheumatoid arthritis is also known as RA, and it's believed to be an autoimmune disorder that arises in ages 25 to 50 and affects women 3 times more than men.
It is also speculated to be connected to genetics, as well as triggered by environment factors including viruses, bacteria, and lifestyle. Lifestyle meaning smoking and in women hormones with estrogen.
In order to understand how RA works, we first need to look at how the normal immune system works.
We have many cells in our body. On some of these cells is a protein called the major histocompatibility complex, known as MHC, coded for by HLA alleles. The MHC protein then presents a self-antigen to other surrounding cells. When a virus or bacteria intrudes, the MHC protein presents a foreign antigen which activates the autoimmune system. This meaning foreign antigens activate the lymphocytes known as B cells and T cells. The B cells work to produce antibodies, and the T cells are represented by cytotoxic cells and helper T cells, which produce cytokines such as TNF and interleukin. The cytokines help the continuous reproduction of the B cells and T cells until the foreign antigen is gone, and bring macrophages into the area, which in turn produces more cytokines, creating a loop. These cells work together to attack and destroy the foreign. In the pathophysiology of an autoimmune disorder, the B cells and T cells are activated by foreign antigens like the normal system. However, once the virus and bacteria are destroyed, the B cells and T cells begin to attack the body's self-antigens. Therefore, the helper T cells that produce the chemicals that aid in the reproduction of the B and T cells cause continuous reproduction. The continuous destruction of self cells cause the area to become inflamed. The cause of this is unknown.
Now, does anybody have any questions pertaining to the normal autoimmune system and the disorder? No? Okay. Well, can anybody tell me what areas of the body RA mainly targets?
Me. It targets the synovial joints in the body.
Okay, can anybody expand on what the synovial joints are?
Synovial joints are the most common in the body and freely moving. Unlike other joints, a joint cavity separates the 2 bones. Lining the cavity is the synovium, and the cavity contains a small amount of synovial fluid which reduces friction between the cartilage of the bones as they move.
Yes?
Okay, so we talked about the normal and the pathophysiology of the autoimmune systems as well as the RA targets, but how do they play into being an autoimmune disorder?
Great question. Once again, RA is a complicated disorder which, while no one understands completely how it works, there are theories that explain the diseases. So, what happens is the events we described earlier of an autoimmune disorder happens within the synovial joints. The rapid division and growth of these inflammatory cells cause the synovium of the joint to thicken. A network of new blood cells is formed. This is called the pannus, and resides between the synovium and the bone. This, as well as enzymes from inflammatory cells, damage the surrounding cartilage and bone.
What would be the symptoms of RA?
Symptoms include stiffness, pain, warmth, redness, and swelling around the joint. Severe morning stiffness, rheumatoid nodules, and loss of joint shape, alignment, and movement are more extreme symptoms.
Because RA is so complex, is there any treatment or cure?
To date, there is no cure. However, there are treatments that can minimize effects. Some of these treatments can include physical therapy, range of motion exercises, anti-inflammatory and immunosuppressant medications, a diet which includes vitamin D, and as a last resort, surgery.
In conclusion, homeostasis is affected because RA interrupts the conditions in the synovial joints. It also causes vasodilation and erosion of bones. MHC, antibodies, and cytokines are the proteins involved in rheumatoid arthritis. Some of these proteins are found in the cell membrane.
Wow, you guys really did your research. Here's a prize.